Remember that my son Ethan is diagnosed with ADHD, and that's attention deficit hyperactivity disorder, and that he was diagnosed a few months ago. And since then I've done quite a bit of research for both myself and for this class, and I found that ADHD is diagnosed without much thought. And I have also found that in an article on September 11, 2009, according to Comer, he reports that in 1996, the UN Narcotics Control Board concluded that ADHD may in fact be overdiagnosed in the United States, and consequently, children taking the medications associated with ADHD may be inaccurately diagnosed. Also, Lefevre reports in 2003 that since the 1990s, medications associated with ADHD, stimulant medications that is, have risen by 700%. ADHD is an overly diagnosed mental illness and therefore overly medicated disorder that can also be treated without medication if properly implemented. First, I will identify that ADHD is overly diagnosed. Second, I will present to you the side effects that ADHD medications have. And thirdly, I will show that the treatment without medication can be done. ADHD, opposed to popular viewpoint, is overly diagnosed. I cannot stress that enough. And one report from the CDC points to the fact that there is an increase in diagnosis. The Associated Press in 2008 reports that the CDC found that the percent of older children with ADHD has been rising by 4% every year. Why the increase? Well, there's many factors that go along with that, none of which are exactly concrete, but one is that IDEA, Individuals with Disabilities Education Act, which allocates funds to schools that identify children with disabilities. And ADHD is a disability. So, with that said, as schools identify more children with ADHD, they receive more funds. Another one is that surveys are specifically designed to identify children with ADHD, but they do not follow up with evaluations. That leads me to my next point. Pediatricians point out children with ADHD. I don't know about you, but that doesn't make much sense to me. Because a mental health specialist, they don't identify children with asthma, which is a common upper respiratory illness. It just doesn't make sense. Another issue is that teachers are sending children in for evaluations for ADHD and not parents. And going back to the pediatrician thing, Comer reports also that 1/3 to 2/3 children receive diagnosis do not follow up with psychological or educational evaluations to conclude the diagnosis. As well, there is Meyer reports in an ADHD, in his article, ADHD is overdiagnosed. He states that in a Wisconsin survey of 750 psychologists, states that 77% of ADHD exams are coming from teachers and not parents. So this disorder includes serious considerations, yet the medications are far more impacting when it comes to, yet the medications hold far more impacting considerations. For most, methylphenidate is the most common medication used. So when weighing the benefits, what problems occur when a medication child, parents should realize that medications are not the route to choose to help a child. Now, methylphenidate is a psychostimulant drug, which is in effect is closely related to cocaine, yet it is not necessarily as potent. In an article in USA Today in 2009, sudden death, it says that sudden death can occur from the result of using this drug. Now, in the past, in 2006, they had a warning out stipulating that children with pre-existing conditions of heart conditions had a chance of sudden death, but now they're saying that without pre-existing heart conditions, you can actually have sudden death caused by methylphenidate. Other things is that stunted growth can also occur from using methylphenidate. It's also known as Ritalin. I don't know if I told you that. In an article, in another USA Today article in 2009, it states that 3 years of children taking this medication, this ADHD medication, that they grow 8/10 less of an inch than children not taking this medication. Now, there's also other side effects. Stuff like hair loss, liver function is caused by it, anemia, depression, anxiety, seizures, and tics that go along with the side effects of methylphenidate. So all the growth and all these side effects must be monitored, but also that the emotional growth must be monitored as well. Now, the Harvard Mental Letter of 2008 says this: behavioral therapy must be considered as the sole treatment if ADHD symptoms are mild or impairment is minimal or the diagnosis is in question. Now, therapy is not just for the children, but it's also for the parents and family as well. It brings about a cohesive plan of action to attack the problem of ADHD. It is beneficial for the child as it does not bring about any physiological effects. In conclusion, ADHD is an everyday diagnosis of one that we all must be aware of. And the medication brings about major side effects. And most people don't realize that you can manage this without therapy. With therapy and without medication. And so, why did people just go straight to the medication? Well, I think a lot of people see it as just a difficult thing to manage without medication. And this is where I have a problem, because they don't want to put in the effort. You know, they look at a kid and they just see him running rampant, and they just, blow him off. And they don't want to go to school, and they don't want to make sure the teachers follow up. With my son, we filled out some surveys, we took him to the pediatrician. The pediatrician just said he has ADHD and said, here's some medication. That's enough of that. All I'm asking you to do is not join a Million Man March, not go donate some money. The next time you see a kid with ADHD that you know and love, be their advocate. That's all I got to say.